On this first slide, we can see tissue changes in emphysema. So on your left, you can see the normal lung, where we have nice looking alveoli. And on the right, you can see lung that has emphysema, and you can see all the major damage that has happened here. So what's significant about this is that the damage has reduced the surface area for the alveoli, which makes gas exchange much more difficult. Also, notice the walls of the adjacent alveoli break down, and what this does is it causes alveoli to combine, thus making the chambers larger. And so one way that this is significant is for external respiration, and significantly what is referred to as ventilation-perfusion coupling. And all that fancy language means is it puts together the blood flow that reaches the alveoli via the pulmonary capillaries and matches that up with the ventilation, which is the amount of gas that is reaching the alveolus for gas exchange. And so this changes automatically with local autoregulatory mechanisms, which is essentially referring to the constriction and the dilation that can happen both in the arterial, which remembers the resistance blood vessels, and the bronchioles. So the oxygen control, the PO2, partial pressure of oxygen. Perfusion needs to be coupled with the PCO2, the partial pressure of carbon dioxide. So one way in which this happens is that there are changes in the partial pressure of oxygen in the alveolus, causes changes in the diameter of the arterioles. So when the alveolar oxygen is high, when there's lots of oxygen that's reaching the alveolus, that's good, and the arterioles can dilate then. However, when the opposite happens, when the alveolar oxygen is low, the arterioles have to constrict to adapt to that. So it's all about just adapting to the situation. So when alveolar CO2 then is high, bronchioles are going to dilate. And when they're low, the bronchioles constrict. So again, it's going to adapt to both gases one way or the other. And these are the adaptations that happen. So this balances out the ventilation and the perfusion by changing the diameters of the local arterioles and the bronchioles, and that synchronizes the ventilation and perfusion. So the regional variations can occur, but hopefully there's this autoregulatory mechanism that corrects things. So our next slide is going to show us the visual of how this occurs, the ventilation-perfusion coupling. And so what we see first on the left, and this is what was mentioned in the previous slides, it's just showing a graphical representation of it. In this first region, letter A, we have ventilation that's less than the perfusion. So that means that there's an adequate amount of ventilation of air of the alveolus. So what needs to happen in response to that is that the pulmonary arterioles are going to constrict, so that allows for the adaptation of more oxygen to get into the blood, be loaded into the blood vessels. So it matches up the ventilation and perfusion. What we'll see on the right side is a different mismatch where the partial pressure of carbon dioxide is low and the partial pressure of oxygen is high. So to adapt to that, the pulmonary arterioles, which lead to the alveoli, are going to dilate. So this matches everything back up where it's supposed to be. So this slide is on internal respiration. And internal respiration, remember, is what's happening at the systemic capillaries. So these numbers are important to remember, and recall that the partial pressure of oxygen is always going to be higher in the arteries that lead to the systemic blood vessels. and lower in the venules that leave the systemic capillaries. And the partial pressure of oxygen is going to be also lower in the arterioles that are leading to the systemic capillaries and higher in the venules that lead away from it. So the venous blood that's returning to the heart now in the systemic veins, the partial pressure of oxygen is 40, and the PCO2, the partial pressure of carbon dioxide, is 45. So let's look at the graphical representation of this, which you have seen before. So now at the internal respiration level, the partial pressure you can see in the systemic arteries is 100. What happens at the systemic arteries or at the systemic capillaries now is there's oxygen that diffuses into the tissue cells, and carbon dioxide goes in the opposite direction. So then the partial pressure of oxygen is lower now in the systemic veins. And carbon dioxide basically does the opposite. It's lower in the systemic arteries and higher in the systemic veins, because the carbon dioxide is going to diffuse in the opposite direction from the tissue into the blood vessels that lead back to the systemic veins.